There's a type of infection so small, yet it can cause elderly individuals to become delirious, collapse, or even be hospitalized overnight. What's most concerning is that it's often mistaken for a severe progression of dementia, leaving loved ones unaware and unprepared. This condition is none other than a urinary tract infection, UTI, a silent yet dangerous threat, especially for seniors living with dementia. Today, we'll explore how to recognize and stop it before it's too late. When a small change is misunderstood as "there's no hope left," this story hasn't happened just once, it's repeated across thousands of families caring for elderly loved ones. Take Robert from Florida, for example. He had been taking care of his mother, Elaine, for nearly 5 years since she was diagnosed with stage 2 Alzheimer's. Elaine remained gentle, remembered who her family was, and always spoke lovingly to them. Then, one morning, everything changed. She became unusually agitated, spoke nonsense, and even looked directly at Robert and screamed, "You're an imposter! Stay away from me!" Robert froze. He thought, has her Alzheimer's reached the final stage? But when the doctor examined her, he received a completely unexpected answer. This isn't worsening Alzheimer's. This is a urinary tract infection. Why are seniors with dementia more prone to UTI? According to Mayo Clinic and the Alzheimer's Association, 1 in 3 dementia patients are hospitalized due to UTIs, compared to only 1 in 8 AIM older adults without dementia. It's not because they're less lucky. Rather, the physical and behavioral changes that come with dementia make them more vulnerable to bacterial attacks. They may no longer clearly feel the urge to urinate. They struggle with proper personal hygiene. Wet clothes or adult diapers might not be changed as often as necessary. They can't express what they're feeling, like pain in the lower abdomen, burning while urinating, or discomfort. On top of that, the immune system of elderly individuals is already weakened, giving bacteria an easier path to invade. What starts as a seemingly simple illness, if left unchecked, can gradually erode their health, disrupt their mental state, and leave family members confused and frightened, not knowing what's happening. UTI isn't just an infection, it's a silent storm. Many still believe that a urinary tract infection only causes mild discomfort, like painful urination or a slight fever, but in those with dementia, the first signs often come as sudden behavioral and mental shifts. They become irritable, agitated, or behave strangely. They begin to feel paranoid or frightened, convinced someone is watching them. Some sleep excessively and feel constant fatigue, while others pace endlessly and cannot rest. These are classic symptoms of delirium, an acute cognitive disturbance common in older adults and especially dangerous when overlooked. Signs to watch for so you don't miss the early window. Rapid increase in confusion. The person suddenly doesn't recognize family members or forgets where they are. Hallucinations, seeing people who aren't there, hearing non-existent sounds. Disrupted bathroom habits, unusually frequent urination or bedwetting after having regained control. Touching their lower abdomen often, or showing discomfort when changing clothes. Urine appears darker in color with a strong, pungent smell. Increased falls despite previously stable mobility. When these signs appear suddenly, don't rush to assume it's just a decline in the dementia journey. It might be a silent cry for help from an illness that is entirely treatable. If you're caring for a parent or loved one with dementia, I encourage you to leave a comment below. Share a story, a challenge you faced, or a surprising discovery. Your story could help someone else notice what they've been missing. And perhaps you'll find someone else walking this same challenging path beside you. What to do if you suspect a loved one has a UTI? If you notice unusual signs like a sudden spike in confusion, hallucinations, or unexplained agitation, the first and most important step is to contact the doctor immediately. Don't hesitate. Don't think, let's wait and see tomorrow. A simple urine test can uncover the cause and guide appropriate treatment. Important, never self-prescribe antibiotics. The wrong kind or incorrect use won't just fail to cure the infection. It could cause the bacteria to become resistant, making the situation even worse. While waiting, make sure to keep your loved one in a cool, quiet environment. Offer warm water in small, regular sips, unless they are on fluid restrictions. Monitor and record any changes in behavior, emotions, or physical state to share with the doctor. Prevention, caring proactively and lovingly. For someone with dementia, prevention is always more effective than late treatment, and small daily actions can make a big difference. Please pay close attention and consider applying the following practices. 1. Ensure the body stays hydrated. Make hydration an act of love. Don't force it. Instead, gently offer more appealing alternatives to plain water, juicy fruits, warm broths, fruit jelly, or a soothing cup of warm ginger water. 2. Establish a fixed bathroom schedule. Helping your loved one go to the bathroom at regular intervals, such as every 2 hours, can reduce bedwetting and prevent prolonged urine retention, which is one of the main causes of UTIs. 3. Maintain gentle but thorough hygiene. Clean the genital area daily with warm water using a personal towel and avoid harsh soaps. If your loved one struggles with self-care, a gentle spray nozzle or bidet can be a great support. 4. Change clothes immediately when damp. Don't wait. Diapers, clothing, and bed sheets should all be checked regularly and changed promptly. Don't underestimate a slightly damp undergarment. It can quickly become a perfect breeding ground for bacteria. 5. Prevent constipation because a healthy gut supports a clean bladder. A diet rich in soft vegetables and fruits, combined with light daily movement, can do wonders for digestion. Prolonged constipation may press against the bladder and raise the risk of urinary infections. If you're still here, it means you're someone who is truly making an effort for your loved one. Please hit subscribe to the Elderly Health channel so we can learn, share, and spread what may seem like small things, but that can save lives. You're not alone, and you deserve support. When knowledge becomes the best protection, UTIs may seem like a minor illness, but for someone with dementia, they can lead to delirium, falls, hospitalization, or worse, sepsis. And sadly, many go undetected in time simply because family members think, maybe she's just getting more confused. But no, when we are attentive enough to notice abnormal changes, informed enough to ask the right questions, and loving enough to act in time, we're not only preserving our loved one's health, but also their dignity. There are questions many people still wonder about, and we understand that. Not everyone dares to ask, but everyone needs to know. That's why, before ending this video, we want to answer a few frequently asked questions to help you feel more confident on your caregiving journey. 1. Can a UTI be completely cured? Yes. If detected early and treated properly, most cases resolve within 3 to 7 days. People with dementia should be monitored closely due to higher risk of recurrence. 2. Is a UTI contagious? It's not transmitted through casual contact, but bacteria can live in moist environments. Maintain personal hygiene and don't share personal items. 3. Do people without dementia have the same symptoms? Yes, but symptoms are easier to recognize. Painful urination, frequent urination, lower abdominal pain. However, some elderly individuals still show subtle signs. 4. Is there anything they should avoid eating? Not mandatory, but it's best to limit sugar, alcohol, and carbonated drinks. Drinking plenty of water, eating porridge, and consuming soft fruits can help the body recover faster. 5. Can antibiotics be used if they're already on dementia medication? Yes, but only if prescribed by a doctor to avoid drug interactions. Never self-medicate with antibiotics. If you've stayed with us to the very end, I believe you truly care about this topic. If you found this video helpful, please comment 1 and share it with anyone caring for a loved one. They might be thankful for life. Let us know in the comments which city you're from or what age you're currently enjoying. And don't forget to hit subscribe to walk this long journey with us. Our channel will always be here with you, quietly, patiently, and full of love. And if there's a topic you deeply care about, please tell us. Who knows, the next video might be made just for you. Thank you, and see you again in the next video.